Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, October 7th, giving you the update from Albany Med. All right, Fred, we have a mix of COVID and non-COVID today, which is great.
Yes.
We'll always start with the New York State numbers. We'll pop open the first graph there. Completely flat, 2,250 in hospital beds in New York State diagnosed with COVID. Next graph here is the capital region. That number is 157. I am optimistically saying it looks as though it's coming down. I think the reality is we're still pretty much hovering.
We are hovering.
Fred, the 7-day percent positive rolling average is 3.6%.
3.6 today. Yep, so it's down a little bit.
We've used 5% in the past as a measurement of to do things in the hospital or not. The 3.6 is under 5, and that's good news.
And that has been slowly trending down, Dennis. So I think your point about the inpatients, it's going to start to happen.
Very good.
It's going to start to trend down.
Next graph here is admissions and discharges here to the medical center. Visually, I think what you can see is we're again, as we've said this in the past, in balance. We had one day a couple weeks ago with a double-digit number. We haven't had that recently.
That's right.
All right, and here's the numbers I think a lot of people tune in for. So here's the current numbers in-house. Fred, we currently have 40 in the hospital diagnosed with COVID, 27 on the floor, 13 on the ICU, 6 on ventilators. Of those 40, 8 are no longer infectious.
That's right.
Of those 40, here's a couple different ways to look at it. 33 are adult and 7 are children. This is going to be important because we're going to talk about vaccines in a second. Of the 7 children that are in the hospital with COVID, 6 of the 7 are under the age of 12.
Right.
I think that's interesting. Let's talk about what's happened in the last 7 days. We've had 26 come in the hospital, 22 go out the hospital. And then let's take a look at the vaccine status of those in the hospital. So Fred, for the admissions in the hospital in the last week, if you got admitted to the hospital with COVID, 88% of those were unvaccinated.
That's right.
If you look at the 13 people currently in our ICU with COVID, 92% are unvaccinated.
That's right.
And if you look at the 6 that are on ventilators in the hospital, 100% are unvaccinated. So I think those numbers speak for themselves.
They really do, Dennis.
Fred, the other thing on vaccines that has been in the news recently is whether or not the age criteria for at least one of the vaccines will lower. This ties back to what I said before about the children in the hospital. We have 6 of the 7 who are under the age of 12, and that ties into a story about potentially Pfizer.
That's right. So Pfizer has put out there some of the data on the study they did in 5 to 11-year-olds, so the next group of children down in terms of age. And they had published some of that data, I want to say in the middle of September.
Right.
It's about 3,200 kids that they put through a trial. They used a dose that's about a third of the adult dose, so that's something to know. And they've now submitted that data to the FDA, and yesterday they formally asked the FDA for authorization to use the vaccine in the 5 to 11-year-old category based on this data. So the FDA has set October 26th, so a couple of weeks from now, for their advisory panel to review this request and the data and then to make a recommendation. So, you know, the data that we've seen looks very promising, very minimal side effects and very good efficacy. So hopefully in early November.
That was going to be my question.
Yeah, hopefully in early November. So the advisory panel for the FDA makes a recommendation. It goes to the CDC, and the CDC finalizes the emergency use authorization.
Fred, you and I were walking on the way over here talking about booster shots. People continue to ask us about booster shots. I received Pfizer. Pfizer is one of the ones that you can get the booster for. I've scheduled an appointment to get that done at a local pharmacy. Let's remind ourselves again what was said about this. As far as the booster shot goes for Pfizer currently, if you're over 65, you should. If you are an essential worker, which we all are, you may. And at this time, we're not offering them on campus, but people can get them in the community.
That's right. It's readily available in the community.
Very good. Fred, you were also talking to me about the exciting news out there regarding a new drug, which is in trials related to the treatment of COVID. And what's interesting about this is this would be an oral pill.
That's right, Dennis. So I've been tracking this for a while. There are a number of what we call antivirals, so drugs that attack some way the virus replicates,
Right.
that have been in development literally for a year now. And Merck is the first company to bring forward some data.
Okay.
So their drug, I have to read it, is called Malnupiravar. This is an oral drug. You start it within 5 days of being diagnosed. It's 2 pills. You take 1 pill twice a day for 5 days. And what they found is really quite remarkable. They were going to do a study of about 2,000
Right.
patients with risk of serious COVID, so, hypertension,
Right.
diabetes, obesity, those kinds of risk factors. The study was actually stopped early because it was so dramatically positive.
That doesn't happen a lot.
It doesn't, but clinical trials, and this is a double-blind clinical
Right.
trial, so the patient doesn't
Right.
know if they're getting the active
Right.
drug, nor does the doctor who's doing the investigation. There's a safety monitoring
Right.
committee, and they do something called an interim analysis. They pick ahead of time a point at which they're going to look and see what's going on, and that's both for efficacy and safety. So does the drug work, and is it really work, and maybe we should stop the study as
Right.
in this case? Does the drug cause problems, and maybe we should stop it because there's a safety issue, or does it look futile? There's really no benefit. So in this case, it was profoundly beneficial.
That's great.
It dropped hospitalization rates by 50%, so within 28 days. It also, in the treatment arm, there were no deaths.
Wow.
Versus 8 deaths, or about a 2.5% death rate in the placebo arm, so the group that did not get the active drug. So the trial's been stopped. The company is preparing its data to submit to the FDA so it can get emergency use authorization. This is kind of
exciting.
a game changer
Yeah.
because it's an oral drug
Right.
that can be used to really prevent those 2 bad outcomes.
It's really exciting. If you think about over the last 18 months, as we've sat here talking about remdesivir
Yes.
or convalescent plasma, monoclonal antibodies, now we have potentially an oral pill. It's really remarkable to have been talking about it as it's rolled out.
Absolutely.
Yeah.
And I think there are others in the pipeline.
Right.
So there's been some news out there about a drug that Pfizer has
Right.
in development that may be soon coming to the fore as well.
And for people who may not know this, they say, well, that sounds unusual. There are other pills that are available for other viruses. We use something called Tamiflu as an
Yep.
example for influenza. So it's not entirely unusual, and we look forward to hearing more about this in the future.
And frankly, the HIV epidemic
course.
got under control based on antivirals that were
course.
developed against that particular virus.
Wonderful. Look forward to hearing more
Yes.
about that in the future. All right, let's end on some positive notes. That was very positive. 3 more positive notes.
Yes.
We haven't done this in a while. I'm glad we can do it today. We want to recognize some members of our workforce as groups who are having a week or a month to celebrate. So Fred, the first one is Physician Assistant Week every year from October 6th to October 12th.
And this is really great, Dennis. So here at the Medical Center, we have hundreds of physician assistants that
Correct.
are part of our provider group. They're really important in many areas. They're the very, very important provider group within our emergent
For
care,
sure.
certainly in the emergency room and everywhere else within the hospital. So shout out to them, very important part of our group.
Fully part of our medical staff, inpatient, outpatient. The history of the PAs is something that's interesting to me because it was started at Duke University in 1965. They were 4 hospital corpsmen who had been trained to act independently, probably overseas, and had come back, and that's the origin of it. So we're very proud of our PAs, and we look forward to celebrating you. Next, Fred, is Sterile Processing Week, and this is an incredibly important group. I'll go first. These individuals, these highly trained professionals, make a huge difference as far as the equipment we use in the operating room safely so that there's no potential infection from the equipment we use. They have to categorize all the equipment, they have to sterilize it, safely handle it. They're very important.
They really are. And Dennis, it's not just the operating room, it's anywhere
That's true.
within the hospital or the practice where we need sterile equipment.
Right.
And that's a lot of places for all the services we provide. They're led by someone, Matt Laporta,
Right.
who just does a fantastic job. Matt's a union grad,
Yep.
really bright guy, really dedicated, has really done a tremendous job leading that group.
So congratulations to all of you in sterile processing. Thank you. Last is Physical Therapy Month, so they get a whole month.
They get a month.
Why don't you go first, and then I want to read something about physical therapy.
So we have physical therapists that are integral to both functions within the hospital as well as caring on the outpatient side for continuing care of patients once they're discharged. They're tremendously important in ambulation, working with people who've been at bed rest, people who've had injuries. Frankly, we couldn't function in the hospital without them.
We could not. I was on their website reading, it says National Physical Therapy Month of America. The Physical Therapy Association encourages everyone to raise awareness, I think this is great, of physical therapy as a safe, effective alternative to medications such as opioids for chronic pain. And we do know that physical therapy works in a lot of areas, but a lot of people have chronic pain, and it's nice to know there's a different form of therapy that is non-pharmacologic in some cases and non-opioid, and the physical therapist can do that.
Absolutely. You know, Dennis, in our spine center, lots of people come in with back pain, and frequently that's the first stop for them. Physical therapy can that deal with their pain.
So 3 great groups, and if you're watching this and you say, what about us? We're coming up soon, please let us know. We're happy to recognize you.
Absolutely.
All right, we're rolling into the weekend. It's fall, and perhaps some people may get a chance to go apple picking. I don't know, maybe get a pumpkin.
Or 2.
If you are working, though, we thank you very much for providing care around the clock, 24/7. Best workforce in the entire region.
Absolutely.
We'll see you next week. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.